Welcome to the ConnectLife Club webinar on kidney health. Hi, I'm Jeremy Morlock, Director at the Kidney Foundation of Western New York. The Kidney Foundation works closely with ConnectLife, and I'm excited for the opportunity to speak with you about kidney health. I'm glad that ConnectLife Club members have already learned about kidney transplants, living kidney donation, and donation after death. The kidney is both the most needed organ and the most transplanted organ. Kidney disease is a hidden epidemic. It's one of the most common health problems worldwide, but many individuals don't know about their own impaired kidney function, and the general public doesn't realize how many people are touched by kidney disease. The transplantation community is always working to close the gap between the number of people who need organs and the smaller number of organs that are donated. When it comes to kidneys, part of the way to make that gap smaller is to reduce the number of people whose kidneys fail. In many cases, kidney failure is unavoidable, but in some situations there are steps that we can take to help prevent or delay kidney failure. In this webinar, we'll get into why the kidneys are so important. We'll also talk about some of the factors tied to kidney disease and ways to protect kidney health. Let's start by talking about what the kidneys do. Most people are born with two kidneys, and they're each about the size of a fist. The main job of the kidneys is to filter wastes and extra water out of your blood. This makes urine. This filtration process helps to keep the levels of electrolyte in your body stable. These electrolytes include sodium, potassium, and phosphate. Every day, the two kidneys together filter between 120 and 150 quarts of blood. Your kidneys also help to control your blood pressure and make hormones that your body needs to stay healthy. Each kidney is made up of about 1 million filtering units called nephrons, and each of these nephrons filters a small amount of blood. The small filters in your kidneys can be damaged in many ways. High blood glucose from uncontrolled diabetes and high blood pressure are among the factors that can cause kidney damage. Damaged kidneys can't filter blood as they should, and this causes wastes to build up within the body. The top risk factors for chronic kidney disease are diabetes and high blood pressure. Other risk factors include heart disease, obesity, lupus, a family history of kidney disease, high cholesterol, and also age. The function of your kidneys naturally diminishes somewhat over time. High blood pressure can damage the blood vessels in the kidneys. When the force of the blood flow is high, blood vessels stretch so that the blood is able to flow more easily. Eventually, this stretching creates scars and weakens the blood vessels throughout the body, including the blood vessels within the kidneys. When the kidneys' blood vessels are damaged, they may stop removing wastes and extra fluid from the body. This creates a dangerous cycle since the extra fluid may then raise blood pressure even more. Kidney disease affects people of all ages, income levels, and cultural and ethnic groups. However, some people have a higher risk than others. 1 in 7 Americans has chronic kidney disease. Many of those people with chronic kidney disease don't know it, because the person can lose up to 90% of their kidney function before symptoms appear. Identifying kidney disease early is important because early identification and treatment may keep chronic kidney disease from getting worse and may prevent additional health problems. Diabetes is the leading cause of chronic kidney disease, followed by high blood pressure. About 1 in 3 adults with diabetes has kidney disease, and about 1 in 5 adults with high blood pressure may have kidney disease. Some communities are disproportionately affected by kidney disease. Among African Americans, diabetes and high blood pressure are the leading causes of kidney failure. Hispanics and Latinos also have a higher risk. Since 2000, the number of Hispanics and Latinos with kidney failure has increased by more than 70%. Diabetes is the leading cause of kidney failure among American Indians. Asian Americans and Pacific Islanders also have a higher risk of chronic kidney disease, but the causes of this risk have not been researched as widely as. Unfortunately, 37 million U.S. adults are estimated to have chronic kidney disease. Kidney diseases are the 9th leading cause of death in the United States. That's more than breast cancer and prostate cancer combined. And every 24 hours, more than 300 people begin treatment for kidney failure. The kidney is the most transplanted organ, and it's also the most needed organ for life-saving transplants. Right now, more than 93,000 Americans are waiting for a kidney transplant. In New York State alone, more than 7,500 people are waiting for a kidney. Sometimes the wait can be long. More than 1,300 New Yorkers have been waiting for over 5 years for a transplant. There is good news, though. In 2020, there were 22,817 kidney transplants in the U.S. All of those transplants were made possible through the generosity of living donors, deceased donors, and donor families. What steps can you take to protect your kidneys? For people with diabetes and high blood pressure, or both of those conditions, managing those conditions is very important. Choosing foods that are healthy for your heart and for your entire body is also a good way to protect your kidneys. Some healthy foods include fresh fruits, fresh or frozen vegetables, whole grains, and low-fat or fat-free dairy products. Make sure to eat healthy meals and cut back on salt and added sugars. Try to aim for less than 2,300 milligrams of sodium each day, and try not to have more than 10% of your daily calories come from added sugars. People with a diagnosis of kidney disease and people on dialysis may have special dietary restrictions. The Kidney Foundation has put together some artwork with tips from the National Institutes of Health on how to protect kidney health. We've made these downloadable and shareable so that people can share kidney health information with their friends and family. One way to keep your diet interesting and healthy is to cook with a mix of spices, not just salt. Make physical activity part of your routine. Aim for at least 30 minutes of physical activity every day. This can help to reduce your stress, control weight, and help people to manage blood pressure and blood sugar goals. Learning how to manage stress, relax, and cope with problems can improve emotional and physical health. Physical activity can help reduce stress, as can mind and body practices such as meditation, yoga, or Tai Chi. If you're overweight, work with a healthcare provider or dietitian to create a realistic weight loss plan. Even a good night's sleep is important to kidney health. Aim for 7 to 8 hours of sleep a night. This can help your overall physical and mental health, and can also help to meet blood pressure and blood glucose goals. Smoking is linked with many health issues and may limit oxygen to the kidneys. Smoking increases the risk of kidney disease and its progression. For people at risk of kidney disease, it's especially important to take medication carefully. This short video explains why.
If you have diabetes or kidney disease, it's important to be careful about the medicines you take. Some medicines may harm your kidneys, especially if you take them when you are sick with the flu or diarrhea. To understand why, it helps to know how the kidneys work. You have 2 kidneys. Your kidneys act as filters. They remove waste and extra water from your body to make urine. The kidney is not one big filter. Each kidney is made up of about 1 million tiny filters. Blood flows into each filter through a small blood vessel and out through a small blood vessel. These blood vessels can expand and narrow to change the amount of pressure inside the filter. The amount of pressure in the filter changes how much blood is filtered. It is important that the pressure be kept in a healthy range. If the blood vessel carrying blood into the filter narrows, blood cannot flow into the filter as quickly. This lowers the pressure inside the filter. Too little pressure means that your kidneys won't filter enough blood. However, if the blood vessel carrying blood out of the filter narrows, blood cannot flow out as quickly. This raises the pressure inside the filter. Many people with high blood pressure, diabetes, or kidney disease take special kinds of blood pressure medicines, such as lisinopril and losartan, and other medicines that end in pril or sartan. In addition to lowering blood pressure in your whole body, these medicines affect pressure in your kidneys and in their filters by opening the blood vessels carrying blood out of the filters. If you have certain kinds of kidney disease, lowering pressure in the filters can protect your kidneys. But if you get sick from something like the flu or diarrhea, the blood pressure in your body may already be low, which makes the pressure in your kidneys low. If you keep taking your blood pressure medicine, the pressure in your filters can get so low that your kidneys won't filter normally. Certain pain medicines can also harm your kidneys, especially if you are taking blood pressure medicines. These medicines, called NSAIDs, have many names, including ibuprofen, naproxen, and others. If you get sick, NSAIDs may cause the blood vessels carrying blood into the filters of your kidney to narrow, lowering the pressure in the filters. This causes the kidney to filter less blood. If you get sick and are taking blood pressure medicines, taking NSAIDs may cause the pressure in your kidneys to drop so much that filtering nearly stops. If you are taking blood pressure medicines or NSAIDs, especially if you have diabetes or kidney disease, you should talk to your doctor, nurse, or pharmacist about how to prevent possible complications. For more information, please visit www.niddk.nih.gov or call 1-800-860-8747.
Make sure to talk to your doctor about your kidney health and any concerns that you may have. If you're at higher risk of kidney disease, make sure that you know your blood pressure, your GFR, or glomerular filtration rate, the amount of albumin, a type of protein in your urine, and also your blood glucose. Most people with kidney disease don't have any symptoms. The only way to know for sure is to get your kidneys checked. Right now, medical associations and the government don't recommend kidney testing for everyone, but they do recommend testing for those at risk. There are both blood and urine tests that will check your kidney function. Your healthcare professional will check your urine for albumin, which is a protein, and will also do a blood test to see how well your kidneys are filtering your blood. If you have diabetes, get checked every year. If you have high blood pressure, heart disease, or a family history of kidney failure, talk with your healthcare provider about how often you should get tested. The sooner that you know you have kidney disease, the sooner you can get treatment to protect your kidney health. A damaged kidney doesn't filter the blood as well as a healthy kidney does, and so more protein may end up in the urine. High levels of protein in the urine can indicate kidney problems. A blood test for kidney function, called the eGFR, is now part of a standard blood test. The best way to slow or prevent chronic kidney disease is to try and reach your blood glucose and blood pressure goals. Healthy lifestyle habits and taking your medicines as prescribed can help you to achieve these goals and improve your overall health. Chronic kidney disease is a progressive disease, meaning it gets worse over time. Kidney disease can lead to other health problems, such as heart disease, stroke, or heart attack. High blood pressure can be both a cause and a result of kidney disease. High blood pressure damages your kidneys, and damaged kidneys don't work as well to control your blood pressure. If you have chronic kidney disease, you also have a higher chance of having a sudden change in kidney function caused by illness, injury, or medications. This is called acute kidney injury, or AKI. Some loss of kidney function from AKI may not be permanent. Many people are afraid to learn that they have kidney disease because they think that all kidney disease leads to dialysis. However, most people with kidney disease will not need dialysis. Dietary modifications may slow the progression of chronic kidney disease. These changes to your diet include decreasing the amount of animal protein that you're taking in, decreasing the amount of phosphorus additives, and limiting the amount of salt that you have. Any of these changes should be done in conversation with a medical professional. Medical nutrition therapy is an individualized plan made for you based on an assessment of your needs by a registered dietitian. The process includes special education on dietary needs and may be effective in helping to slow the progression of kidney disease and may help people to prevent or delay end-stage renal failure. Unfortunately, only 10% of non-dialysis patients see a dietitian. There are two main types of dialysis treatment used for people whose kidneys have failed. Hemodialysis is a treatment that removes wastes and extra fluid from your blood. It can be done at home or in a dialysis center. During hemodialysis, the blood is pumped through soft tubes to a dialysis machine where it goes through a special filter called a dialyzer or an artificial kidney. As the blood is filtered, it's returned to the bloodstream. Only a small amount of blood is out of the patient's body at any time. In-center treatment usually takes place for 3 to 5 hours, 3 times a week. People who do home dialysis have more flexibility about how often it can be done. If it's done daily, the treatment time would be about 1.5 to 2 hours. Peritoneal dialysis is a home-based treatment that can be done anywhere. It must be done daily. A patient needs a minor operation to place a catheter inside the abdomen before beginning peritoneal dialysis. The blood is cleaned inside of the body, not outside. The lining of your abdomen, known as the peritoneum, acts as a natural filter. During this treatment, a cleansing solution flows into the abdomen through a soft tube. Waste and extra fluid pass from the blood into the solution. After several hours, the solution is then drained and refilled with a fresh cleaning solution to begin the process again. It usually takes about half an hour and is called an exchange. Kidney transplantation is also an option for some patients whose kidneys have failed or are about to fail. In a transplant, a healthy kidney from a donor is transplanted into the body of the patient. The kidney may come from a deceased donor or from a living donor. Once someone receives a kidney transplant, they'll need special medication to keep their body from rejecting that transplant. Usually what happens is that the transplanted kidney starts acting as a filter, the way that a person's original kidneys did. Kidney transplantation is a treatment, but it's not a cure. Kidney transplant recipients still have a chronic disease and may still need additional medications. Erie County Medical Center is the transplant center that serves our region. The Kidney Foundation works closely with ECMC to provide kidney health and transplant information to the community. ECMC has a shorter wait time for kidney transplant than any other center in the country. In 2020, ECMC performed 134 kidney and kidney pancreas transplants. Local people who need a kidney transplant may also be working with other centers. Common ones that we see are University of Rochester Medical Center, Strong Memorial, the University of Pittsburgh Medical Centers in Erie or Pittsburgh, and Cleveland Clinic. I mentioned earlier that there are efforts to close the gap between the smaller number of organs that become available for transplant every year and the number of people who need kidney transplants. Part of the way of doing this is by reducing the effect of chronic kidney disease among the general population. Now, efforts to improve kidney health have focused in 3 main areas. The first is prevention, and that includes controlling and preventing diabetes and high blood pressure among the general public, as well as increasing awareness of chronic kidney disease and its risk factors in public. Other programs focus on slowing the progression of kidney disease and preventing complications and other illnesses that may arise. Programs for this include education and testing for people who are at higher risk of chronic kidney disease, better education on nutrition and ways that diet can affect kidney health, improved treatment of kidney disease and other diseases, that's improving the understanding of the diseases among the patients who have them, as well as improving professional knowledge for medical care that they're receiving, and preparing people earlier who may later need dialysis or a transplant to better understand that and be more ready to start dialysis or to receive a transplant. Other public health programs also focus on treating kidney failure. That includes improving the start of the dialysis process and getting transplants for more patients. There are 2 public health programs that I want to talk to you about today, both of which aimed to reduce kidney disease and its impact in different communities. The first was a program by the Indian Health Service, and the results were published in 2018. Now, this focused on diabetes care specifically, because diabetes is the leading cause of chronic kidney disease. And they found that by improving diabetes care in the Native American communities, they could improve the results on kidney health. They used a population-based program, so they had programs out in the community, including health education about diabetes and kidney disease and risk factors, and also that they worked to make community resources more readily available. That includes rides to treatment and clinics, more testing, and access to better food. Now, with healthcare professionals, they worked to set up a team approach so that clinics and doctors, community workers, and pharmacies could all work together to make sure that they had the resources and information that their patients needed. Now, this diabetes focused program, they saw that there was a 54% decrease in new cases of kidney failure among Native Americans and Alaska Natives with diabetes. Now, that's a huge decrease, especially when the rest of the population in the country was seeing an increase in new cases of kidney failure among people with diabetes. The second program that I want to talk about took place in Pakistan, and this program focused more on blood pressure as a cause of kidney disease and also education on other risk factors. So they had a bunch of trained community health workers who went out into communities and shared information with people about improving diet, the importance of not smoking, increasing physical activities, and taking blood pressure medication as prescribed. A lot of times people may receive blood pressure medication, a prescription for that, but they don't always take it. And so they worked among the population to improve awareness of these things that can affect kidney health. There was also a professional education program where they worked with doctors in the area so that they had the most up-to-date information on controlling blood pressure. Now, what they saw was that the people who were in this test group didn't have any change in their kidney health when they looked back 7 years later. But the broader population, people around them, there were many new cases of kidney disease and kidney failure. The New York State Department of Health has called for efforts to improve healthcare provider education about kidney disease and also raise public awareness about kidney disease. Now, for medical providers, they've been focused on improving blood sugar, blood pressure, and cholesterol control among people who have diabetes or hypertension. And they've also been focusing on improving early detection and treatment of kidney disease, so more testing in the communities and more awareness among medical professionals about the tests and what they mean. Now, on the public education side, they've been focused on sharing information on living a healthy lifestyle, a lot of those changes that we've talked about earlier today, the importance of controlling blood pressure and blood sugar and cholesterol, and also the importance of keeping regular appointments with primary care providers. A lot of times, kidney disease can go undetected because people who feel well don't always go to their doctor's appointments. The organizers of World Kidney Day have named 2021 the year of living well with kidney disease. Kidney disease can be invisible to outsiders, but illness and treatment can be overwhelming for patients and families. Kidney disease can cause fatigue, pain, digestive problems, and sleep problems. Depression and social isolation are also often challenges for people with kidney disease, especially when it's more advanced. People living with kidney disease want to be able to live well, maintain an active social life, and have a sense of control over their health and well-being. Treatment plans are often focused primarily on survival, but in surveys, people who actually have kidney disease say they care more about engaging in meaningful activities. This includes working, spending time with family, travel, sports, social interactions, and recreational activities. There's a movement to call for more patient-centered care and shared decision-making for people with kidney disease, helping them to become more active in their own lives. I'd like to talk a little bit about our organization, the Kidney Foundation of Western New York. We're based in Buffalo and are dedicated to increasing awareness and improving the lives of those with kidney disease. We provide patient support, advocacy, and assistance with emergency needs. We're not affiliated with the National Kidney Foundation, but we do work closely with local health organizations in our community. The Kidney Foundation of Western New York works to raise awareness of kidney disease. We also try to increase public knowledge of the risk factors that can lead to kidney damage. We provide information on the prevention and treatment of kidney disease to patients and families. Our organization also provides professional education for people in dialysis, physicians, nurses, and others who work with kidney patients. We work to promote organ donation, both among living donors and among deceased donors through the New York State Donate Life Registry. In most years, our foundation provides free community health screenings with community partners. Right now, those screenings are on hold during the COVID-19 pandemic. Within the 8 counties of Western New York, we provide patient support and advocacy, We offer information on healthcare options, and we assist with emergency needs. These needs can include information and emergency assistance, such as nutritional supplements, medical ID bracelets, transportation to and from dialysis and other medical appointments, and financial assistance for people with kidney disease who are facing an emergency. We also have information, resources, and more on our website at kfwny.org. We use Facebook and other social media platforms to share information about kidney health and our programs. As a quick recap, this video from the National Institute of Diabetes and Digestive and Kidney Diseases covers key information as well as questions that people who are concerned about kidney health can ask to medical professionals.
Your kidneys are an amazing filter. They remove things your body doesn't need, like wastes and extra water. When your kidneys are damaged, you could have a serious condition called kidney disease. More than 9 out of 10 people with kidney disease don't even know they have it. And if you have diabetes, high blood pressure, or a family history of kidney failure, you're especially at risk for kidney disease. So the sooner you find out, the sooner you can get treatment. Start by talking with your healthcare provider. Here are 3 questions you can ask to start the conversation. Have I been tested for kidney disease, and how healthy are my kidneys? Testing is easy. It involves a blood test and a urine test. Your healthcare provider will use these tests to check your kidney function. How often should I get my kidneys checked? If you have diabetes, get checked every year. If you have high blood pressure, heart disease, or a family history of kidney failure, talk with your healthcare provider about how often you should get tested. What should I do to keep my kidneys healthy or manage my kidney health? Even if you don't have kidney disease, your healthcare provider may recommend steps to keep your kidneys healthy, like controlling your blood pressure, making healthier food choices, and being more physically active. Kidneys play a vital role in keeping you healthy, so it's important to take care of them. Talk to your healthcare provider about your kidney health. Visit niddk.nih.gov to learn more.
Thanks for joining this webinar about kidney health. I'd like to encourage everyone to learn more about kidney disease and watch some of the video stories of kidney transplant recipients and living donors. These resources and many more are available at the website for the Kidney Foundation of Western New York, kfwny.org. Thank you.